My name is Dr. Ryan Shelton. I am a functional medicine doctor with My Go-To Doc. Thank you for joining me again. We're here each and every Tuesday talking about a variety of topics regarding functional medicine. I know a number of you are new to functional medicine. The last couple of weeks, we've just gone through a general review about the potential benefits of functional medicine to you if you're new to it. Today, we're going to talk about a topic that really is the beginning point of further discovery about your health, and that's functional medicine labs. And we're not necessarily going to be talking about all of the labs that can be run. We just want to run through the different types of categories so that you know the information that can be gathered through some of the functional medicine testing. A lot of conventional physicians are not trained in the functional medicine laboratory testing, and they do provide a wealth of information. So um, let's go through just some of the basics of functional medicine. Now, some of the specimens required of functional medicine testing are different than what conventional labs may request from you. Most conventional labs are done through blood testing, through a blood draw. Many of the functional medicine tests can be done through blood draw as well, but some of them require stool samples, saliva samples, and others. Some actually require your breath to be collected for testing for H. pylori, for instance, in the stomach. So sometimes different types of fluids, different types of body specimens need to be collected. And if a blood draw is not required, and require that you go to a local phlebotomy draw station, then more times than not, the lab kit can be mailed directly to your house. So you can collect the specimen in the comfort of your own home according to the instructions in the lab kit, send them directly off to the labs, and then we get the results typically within 3 to 7 business days, depending on how busy the labs are. So first, let's just walk through, and there will be plenty of time for questions at the end of this. So first, I just want to run through some of the basic categories of functional medicine lab testing and what we're looking for, what can be discovered through some of these tests. So the first bullet point there you see basic. So what does that mean? Functional medicine testing, of course, includes the typical testing that you would receive through your primary care provider, through your healthcare provider. That includes CBC, immune analysis, red blood cell analysis, basic comprehensive metabolic panel, looking at liver health, kidney health, looking at proteins in the body, looking at some basic inflammatory markers. And my basics always include a panel of a thyroid panel, a vitamin D panel, vitamin B6 panel, and I also look at copper and zinc levels in the blood because they can be indicative, either high or low copper or zinc levels can be indicative of fatigue, of muscle pain, of mental behavioral imbalances and anxiety and depression. So just a basic workup that might be indicated through your conventional medical doctor. Next, we can look at GI health. We can look at if you're producing adequate amounts or excessive amounts of stomach acid, of digestive enzymes. We can look at stool samples and see what kind of bacteria are growing there, if they're helpful for your digestive tract, if they're harmful for digestive symptoms that you may be experiencing. More times than not, GI testing involves either a breath sample or a stool sample. GI testing, we can look at organic acids. We can look at which foods you are breaking down effectively and which foods you're not breaking down effectively. And of course, we can look at overall GI health in assimilation as well. Next, adrenal and stress. So we're all under stress, especially as we have gone through this pandemic together. And the adrenal glands produce a number of hormones: cortisol, DHEA, epinephrine, norepinephrine. And these can become imbalanced, they can become dysregulated in their circadian rhythms. And so, looking at adrenal hormones, not just the total amount of adrenal hormones, but what that circadian rhythm is doing throughout the day, making sure that you're producing the most amounts of cortisol in the morning, and that it's dropping off throughout the day. So stress and sorry, someone keeps calling me. Stress and adrenal health, very important to look at issues of fatigue, brain fog, muscle aches, sleep, anxiety, depression. And this is typically collected through a saliva sample. Mold and environmental toxins, very important too. The prevalence of mold sensitivities is becoming increased, and environmental toxins, our exposure is ubiquitous and excessive. And so, looking at, give me just one moment, looking at your exposure to molds, there are metabolites in there are metabolites in the blood that are indicative of excessive toxic mold exposure, and certainly other environmental toxins as well. Metabolic function is very important. So this is regarding your metabolism that occurs with carbohydrates, with proteins, with fats, and really intracellularly, it occurs in those power boxes within the cells called mitochondria. So we can really get a sense of what the mitochondria health is doing through looking at overall metabolic function. Of course, food allergies, food sensitivities becoming more common. It's estimated about 1 in 3 adults have either a food allergy or food sensitivity. And of course, those can become exacerbated post COVID. And so, looking at food allergies, food sensitivities, and this is typically a blood test that is utilized. There are different antibodies that can be looked at, if it's IgM, IgG, IgA, depending on acute exposure, chronic exposure, ongoing exposure. So, looking at different antibodies for food sensitivities and food allergies can be very important to identify and remove from your diet. Next, we kind of touched on this with mold and toxin exposure. Environmental toxins are, again, ubiquitous, and they are increasingly affecting our ill health. And so there are a number of different tests that can be utilized. We can look at the fat soluble environmental toxins like the BPAs and the phthalates. We can look at heavy metals. And we can do this through stool, we can do this through urine, we can do this even through saliva, especially for the heavy metals. And there are panels that we're looking at. We're rarely ever looking at one heavy metal like mercury. Typically, it's a panel of several heavy metals or other environmental toxins. We can look at autoimmune disease. So there are a number of different autoimmune panels that can be ordered to identify if you have an autoimmune process going on. And yes, it can certainly be exacerbated post-COVID. And so there are a number of autoimmune panels that can be ordered as well. I apologize. Someone keeps calling and distracting me. I'll try to block them here. Okay. And finally, we can look at panels of inflammation, of microclotting, different proteins, spike proteins within the body, to determine if a hyper-inflammatory state is causing some of the symptoms in your body. Now, the different systems that we're testing when we are utilizing functional medicine labs are the endocrine system. So we're looking at hormones, stress hormones, adrenal hormones, thyroid hormones, sex hormones like estrogen, progesterone, testosterone. Um, we can do some interesting genetic testing to look at neurotransmitters and potentially medications that work best for treating anxiety, depression. We can look at genetic uh, influences on your digestive health, on your immune health. And so there's a vast amount of information genetically that we can look at. We can even look at certain markers for cancers through genetic testing. Of course, we look at hepatic function. So this is liver function, understanding how well that filter, that all important filter of your blood, of environmental toxins, of food, how well that filter is able to detox the system from what it needs to detox from. Next, the immune system. So we can get a good sense of how well the immune system is working. If it's under functioning, if it's excited and over functioning and causing autoimmune like processes. We can look at um, we can look at infection as well. So we can look at viral infection, we can look at bacterial infection, we can look at parasitic infection, and it is a very common story that COVID can reignite some of these old infections, be it bacterial, perhaps Lyme's disease, other viruses like CMV or mononucleosis, and several others as well. So we can look at other coexisting infections as well. Let's see here. Can we get slide 2 back up? There we go. We can look at neurological health. So again, looking at those neurotransmitters, the dopamine, the epinephrine, the norepinephrine, the serotonin levels, the GABA levels, uh, because in imbalance in any of these neurotransmitters can cause problems with stress, can cause problems with brain fog, and can cause problems with poor sleep. We can look at nutrition. So yes, we can look at the macronutrients, the proteins, the fats, and the carbohydrates, but we can also get a good idea of any micronutrient deficiencies like vitamins and minerals. There are some unique tests that can be run. We take a blood sample and we grow them on petri dishes for a few days and determine which nutrients you might be deficient in. And of course, we mentioned tumor markers as well. And further on, for functional testing, of course, different samples can be taken. Stool testing, we're looking at the microbiome. We're looking at inflammatory markers in the GI tract. We can be looking for environmental toxins in the stool. OAT stands for organic amino acid testing or organic acid testing. This can be revealing in showing how well you're able to digest and assimilate foods. Intestinal permeability testing. So if you have what's colloquially called leaky gut, we can see if your intestinal integrity is allowing through substances that can promote inflammation, can promote allergies, can promote autoimmune diseases. So getting an understanding of how well those tight junctions in your intestines are can be revealing for your health. SIBO testing, small intestinal bacterial overgrowth is SIBO. And this can lead to a number of not only GI symptoms, but systemic symptoms as well: fatigue, brain fog, poor sleep. And so testing for SIBO is important for some patients. Food sensitivity, food allergy testing. Of course, that's usually done through a blood test. It's a panel. The panel that I run tends to be 97 or 96 different foods. So it's quite extensive. And again, we can look for acute reactions to food, chronic, ongoing reactions to foods, and get a good idea of if you're sensitive or allergic to certain foods. Environmental testing, this tends to be either through a urine sample, a stool sample, or saliva sample. Again, we're looking for heavy metals and then those forever chemicals like the fat soluble plastics and BPAs and phthalates and others. Heavy metal testing, we already talked about. Lyme and co-infection testing. And then the genomind testing, that refers to a thorough genetic neurotransmitter testing to see if there are any imbalances with your neurotransmitters. So was that the last slide, Julia? I think it was. Nope, one more. Okay, great. So why do we do this? Well, we need to identify the threat. What is causing this dysregulation in the body? What is causing the imbalance in the function of your body? So we need to identify the threat. Maybe it's a pathogen. Maybe it's a microorganism, a virus, a bacteria, a parasite. Typically, they're done through blood, but if it's intestinal, those are done through stool. We've already identified the stool analysis. Short chain fatty acid is what the CFA stands for, short chain fatty acid. We can get a good idea of your microbiome, of the good bacteria that's growing, of the food that feeds the good bacteria, the short chain fatty acids, and then the organic acids, the OAT, their organic acid testing. We can do that through both the urine. Through the urine and the stool. And here we're just looking at overall digestive health. Homocysteine markers can be important because those are markers of inflammation. And again, on my basic panels, I always include a vitamin B12 and a vitamin D because they're so important for immune health, for inflammation, and for overall health. The next category would be HPA and sex hormones. So this is basically your endocrine system. HPA stands for hypothalamic pituitary adrenal axis. That's the main axis or railway in your body that communicates with hormones throughout your body. And here we can look at a number of different hormones: DHEA, cortisol. Those are adrenal hormones. We could do a thyroid panel. We can look at the different sex hormones, the E1 or estrogen 1, that's estrone, estradiol or E2, estriol or E3, progesterone, testosterone, sex hormone binding globulin, and prolactin. And then, of course, we can look at the neurotransmitter metabolites in the urine primarily to see how much or what kind of imbalance of neurotransmitters you may have. And then finally, we can look at inflammatory and oxidative markers in the body. This includes tests, blood tests, such as C-reactive protein, ESR, ferritin, fibrinogen, to get a sense of if there's some microclotting that might be going on internally. Cyrex array cytokines. So cytokines are pro-inflammatory. They promote inflammation, and we can get a good idea if inflammation is problematic in the body. ApoLDL is a great marker for inflammation in the bloodstream. Hemoglobin A1C is a great marker for looking at insulin production over time and insulin sensitivity over time. And then finally, vitamin D. So I think that's the last slide. Yeah. So that's just an overview of some of the basic functional medicine lab testing that can be utilized. It's quite extensive, and a lot of very valuable information can be obtained through that testing. Okay. So let's jump into questions, see if there are any questions here. How do you check mold? What tests? So that is a metabolite test. It's difficult to test for mold directly, but if your body is exposed to mold, it will break down some components, some chemicals that mold produce, and those can be identified in the bloodstream. They can be identified in the urine. They can be identified in the stool. So what we're looking for here are mold toxin metabolites, and they can be discovered through a number of different samples, specimen samples. Let's see here. Next question. What autoimmune panels test specifically can we ask our doctor to run? I was already told I have reactivated EBV, but was told there was nothing I can take to help it go latent again. So, yes, EBV is quite the character. It likes to stick around in the body, and it is hard to completely eradicate it. What we try to do in functional medicine is decrease inflammation, support the immune system so it can fight off EBV as best as possible. Natural antiviral agents can be helpful. In terms of the autoimmune panels specifically, it's difficult to give you specific advice because I have no idea what you have going on. Let's see, your name is Colleen. I have no idea what you have going on specifically, but we can look at autoimmune markers, and they tend to be intranuclear markers. So antibodies against certain compounds in the nucleus of the cell that can be revealing for autoimmune disease. So there are a number of different panels to choose from. It kind of depends on if you have an arthritic condition going on, a GI condition going on, uh, mental health issue going on, an endocrine or hormonal issue. It really just depends on what your case, how your case presents. But there are a number of different panels to choose from. Let's see. Next question. It's not easy to get these tests done. The doctor won't order them, only sending you to other doctors who don't even believe in long COVID. Yes. Wouldn't even help me find a functional doctor that my insurance can cover. Yes. So the majority of functional medicine doctors, and I've got to be honest with you, are not covered through insurance, and unfortunately, all of the value that these functional medicine lab tests can provide, the downside is that they typically are not covered by your standard health insurance. There are some plans where if you just have the gold platinum plan that covers everything, perhaps it would be covered. Uh, Certainly, health savings accounts can be utilized to pay for the functional medicine lab testing, but more times than not, these functional medicine tests are out of pocket, and so is the expense to see the actual functional medicine doctor themselves. It's just the system that the insurance company has set up for us, unfortunately. Um, and you're right, it's not easy to get the test done. Most conventional doctors aren't even aware of them, and certainly don't know how to order them case by case as patients walk through the door. So seek out a functional medicine doctor, and just realize that many of the tests that might be recommended that we've kind of glanced over may not be covered by insurance companies, unfortunately, and that's not the fault of the provider. That's the fault of the insurance company, unfortunately. Let's see. This is a comment or a question. NAC good for brain fog? Yes, it can be. It works on a couple of enzymatic processes in the brain. It's a great antioxidant. If you have oxidative processes going on in the body, NAC can be quite good for that. As a side note, NAC is also a mucolytic. So if you are experiencing congestion of the, oh my goodness, I went dark. If you are experiencing congestion of, hmm, if you are experiencing congestion of the sinuses, of the chest, and mucus is a contributing factor to that. NAC can help to break up the mucus and help to thin it out and uh, have it be more able to be expelled from the body. So, yes, NAC can be helpful for brain fog. Uh, a comment, they are worth it. Yes, functional medicine doctors are worth it. Good comment. Let's see. Let me jump on another one here. The smell of my stool was how I knew I had COVID before there was any testing or vaccines available. That's a common comment. I've heard of that. And of course, I'm sure if you watch the news, many cities have tracked the existence of COVID either in on the incline or decline through sampling stool at sewage plants because it uh, parts of the COVID virus can be identified in the stool, and it can change the GI tract dramatically, change the symptoms, cause symptoms of the GI tract: gas, bloating, poor digestion, diarrhea, constipation, and change of the smell of stool. Let's see. Da-da-da. Okay. Let's see. What is the main difference between my primary care provider, I'm guessing lab test, and the functional medicine test that you would order? Well, if it's just a screening test, and honestly, that's what most PCPs run, are just screening tests. We're looking at CBC, comprehensive metabolic panel, maybe TSH, which is a test for thyroid, maybe a vitamin D. It's becoming slightly more popular among conventional PCPs. Uh, Maybe a urinalysis, just looking at kidney function. The CMP, or comprehensive metabolic panel, looks at liver health as well. Um, they might tack on a hemoglobin A1C, looking at insulin health. Certainly, part of that comprehensive metabolic panel is looking at fasting glucose levels. Occasionally, you might see a vitamin D, vitamin B12 tacked in, but that tends to be it in terms of screening tests. They really don't look for many markers. The cholesterol panel, they tend to throw that in as well. If you're a female, they might do a estrogen or E2 test, which frankly isn't really worth their time doing a blood test for a simple E2 or estradiol. If you're a male, they might throw in a testosterone test, but that's usually the extent. They really don't branch out to look at inflammatory markers, at immune function, at digestive health, and those are really the systems that are involved with chronic disease: the immune system, the endocrine system, or the hormonal system. How much inflammation is going through the body, what the digestive tract is doing, what environmental toxins might be there. Very, very few PCPs order those types of labs. Let's see. Next question. I'd like to have those tests done, but how much does all that cost? Well, I would not recommend that you do all the tests. I would recommend that you work with a functional medicine doctor to really understand the specific tests that might be indicated for you, if they're endocrine tests, or food allergy tests, or environmental toxin tests, or endocrine tests, or inflammatory tests, immune tests. All of the tests may not be necessary for each and every patient. It really depends on how you present and what your symptoms are, and the tests vary widely. I would say they range from maybe the simple, more basic test can run maybe $69, and a full panel of environmental toxins and hormones might run $350. So it really just depends on the tests that are ordered and how deeply you want to look into your functional physiological health. So anywhere from 50 to $400. It just really depends. Okay. Let's see. Next question. My vitamin D was very low, and my primary prescribed 50,000 units once a week. And I felt even worse after I took only one: extremely dizzy, lightheaded, and severe anxiety and panic attacks from them as well. Yes, vitamin D has quite the role to play in neurological health, and depression, anxiety. And for some individuals, why is that not clicking off? For some individuals, they just cannot handle that that big dose of 50,000 units once per week. So I've seen that. It happens. And what I would recommend is that you consider taking a smaller, more daily consistent dose of vitamin D, and it will very likely be uh, tolerated much better. Also, check out your vitamin B12 levels. Sometimes if those levels are low, taking vitamin D can cause symptoms. But the first place to start is just a daily dose of a much smaller dose, maybe in the range of 1 to 5,000 units orally vitamin D taken every day. It's not clicking for me. Okay, let's see. Is there a natural way to treat chronic strep A versus without antibiotics? Immune markers and vitamin nutrients are optimal. Great. Well, here we're really looking at maybe some antibacterial, antimicrobial, botanical agents. Um, One at the top of the list is historically berberine. It does have antimicrobial activity against strep A. I can't promise that it will be effective for you, but that botanical agent berberine is certainly at the top of the list. It's something to consider. Let's see. Next question. Long COVID insomnia. What can help? So we know that COVID affects the neurological system. It causes imbalances in neurotransmitters. It causes, we know it affects the endocrine or hormonal system. It causes imbalances in the hormones as well. So the first two places I would look would be what level of inflammation is going on in the body. Maybe I would order some neurotransmitter metabolite testing to see what those serotonin dopamine levels are. You can actually also test for melatonin, which is the sleep hormone, and see what those levels are. They may be diminished, but also looking at the endocrine system as well, looking at adrenal hormones and the sex hormones. Let's see. Yeah, estrogen, progesterone, testosterone, again, looking at adrenal hormones, the DHEA, the cortisol, and the thyroid hormones as well, doing a thyroid panel. So looking at the root cause is always the first step. If you haven't already, you could try taking some melatonin, and of course there are some herbal agents out there that can be helpful. An amino acid called 5-HTP can be helpful. An herb that's been used for a long time for sleep is valerian, that can be helpful for some patients. So there are lots of avenues to try to improve sleep, and of course ensuring proper sleep hygiene, getting away from screens for an hour before bedtime, making sure that your bedroom is quiet and dark and you're not stimulated. And if you have things that you're ruminating over, maybe keep a journal by your bed, write those things down so that they're out of your head and you can deal with them tomorrow. The important is sleep hygiene as well. Let's see. Next question. How do you treat severe inflammation of the GI tract from COVID? Good question. So, first, COVID can initiate the new onset of food allergies, food sensitivities. So, you first need to discover if you are consuming anything that's contributing to the inflammation, any foods or uh, snacks or okay. keeps blacking out on me. Sorry, guys. um, to see if there are any foods or culinary spices that you're consuming that might be exacerbating the inflammation. Identifying and removing those foods is always step one. And then you have to try to repair the system, repair the inflammation. So, inflammation in the GI tract, it causes something called leaky gut, where the gaps between cells get leaky, and so foods and other things in your digestive tract, like bacteria and viruses, can get through those gaps when they're not supposed to be and cause inflammation throughout the body. So, there are supplements that can be taken to help repair that leaky gut and the intestinal permeability. And then the final step is to re-inoculate the intestines with a good healthy microbiome, the good healthy bacteria that not only fight off the bad guys, the bad bacteria, the bad viruses, but they also help to train our immune system. And so much of our immune system is located in the GI tract. The good healthy bacteria can help to train the immune system so that they are only going after the good guys, or only going after the bad guys rather, and not the good guys, and help to decrease inflammation throughout the body. So uh, there are steps, and we call them the R. So remove the trigger agents, identify and remove the trigger agents, repair the integrity, and then re-inoculate the intestine with the good healthy bacteria. What can make you black out in the morning with no warning? Oh goodness. Well, a number of things. One common scenario that COVID has been causing is something called POTS, which is a dysregulation of the autonomic nervous system in the body. Again, wreaking havoc on the nervous system, and it's particularly problematic when individuals change positions. So going from a lying down position to a sitting position, or a sitting position to a standing position, uh, the autonomic nervous system is not able to regulate blood pressure like it should. And so you stand up, and within seconds or maybe a few minutes, your blood pressure just becomes erratic. Maybe it spikes for a bit and then it drops. That tends to be the cause of blacking out in the morning. So something called POTS, which COVID can contribute to. Um, Very important with POTS patients is to stay very well hydrated, and to make sure that you're getting plenty of electrolytes, not sodium, but other electrolytes like potassium and magnesium in particular. The POTS patients do pretty well with those two minerals in particular. Let's see here. Jump into the next question. I recently had a vitamin D level of 90.3. My PCP office called to tell me to stop my vitamin D 5,000 units because that was high. Isn't that in range? Well, uh, that's up for debate. So even among physicians, we can't really decide on what normal range is. That would certainly be considered on the high end of normal, if not slightly high. Uh, I would call that in the normal range, 90.3. Uh, Ideally, the sweet spot of vitamin D is probably somewhere around 60, 65, 70, something like that. I would agree with your PCP in stopping the 5,000 units per day. You might consider getting retested in about 3 months, and then you can always begin taking a lower dose, say 1,000 international units of vitamin D on a daily level. But yeah, it might be good to take a break from the vitamin D for a little while with levels at 90.3. Oh, this is a follow-up question. What dose do you recommend for vitamin D since I can't handle 50,000 units? I don't know what your levels are. Going back to the immediate last question, the typical daily dose is usually either 1,000, 3,000, or 5,000 milligrams a day. Since you have already experienced some sensitivity to vitamin D, I might start with 1,000 international units per day. See how you do with that for a week or two. If everything seems fine, then you can bump it up to 2,000 or 3,000, and certainly get your levels rechecked in about 3 months or so. Next question. Is it safe to do cold showers for the benefits, even if I have pericarditis from long COVID? Yes, it is safe to do cold showers for the benefits, for its benefits, even if you have pericarditis. Yes. So we have some questions coming in on supplements, and I've kind of skipped over those. The reason is next week. So this week's topic was on labs. Next week's topic is going to be more specific on supplements. So I encourage you to tune in next week, and we can talk more about the supplements that are available. Let's see. Never had a food allergy and now extreme bloating, burning throughout the GI tract, up through the esophagus, on prescription meds, but do not help. Removing gluten, great. Can't seem to eat anything that doesn't produce acid. Anything you can add that would alleviate this? So again, without knowing your specific case, the first step is to get a food allergy, a food sensitivity panel run. Again, a full panel, not just gluten, looking at dozens and dozens. My panel is 97 foods. Getting a food sensitivity panel done to see what you might be sensitive to, and what you might want to avoid. The top two foods consistently tend to be gluten foods and dairy, uh, but many others make the list as well. And it's very common to have GI symptoms after COVID, with extreme bloating, heartburn, again, constipation, diarrhea. And again, without knowing your case specifically, a good place to start would be two. Um, One would be a good high quality digestive enzyme taken with foods containing at least amylase, protease, and lipase. Um, Whether or not it should also include hydrochloric acid, I can't give that advice because I don't know your case. Some people do better with those enzymes mixed in with hydrochloric acid. Some patients do better with just the enzymes themselves. So, one, digestive enzymes, and two, a good quality probiotic would be helpful for you as well. Let's see. My COVID infection was Omicron, and I'm still losing hair massively. So, that is That is very likely an endocrine cause. So, again, the COVID can cause major disruptions and dysregulation in the hormone system in the body. And if you're experiencing hair loss, it's very likely due to a hormonal balance. It can be adrenal hormones, it can be thyroid hormones, it can be sex hormones, but that's likely a root contributing factor. Been taking spermidine and resveratrol consistently along with Nutrafol. That's become popular, huh? Nutrafol, recommended by derm doctor. Rampant histamines, yeah. So I would consider getting a good hormone panel, looking at thyroid, looking at adrenals, looking at the sex hormones, and then if your histamines are high, there are natural and over the counter and prescription antihistamine agents that can contribute to hair loss. Uh, Histamines can contribute to hair loss, and taking an antihistamine, be it natural, over the counter, or prescription, can be effective. So that's something else to consider as well. Okay. This person has lots of questions. What do you consider the best gut test? That depends on what you might have going on. Certainly, food allergy, food sensitivity is where it starts. Identifying and eliminating foods that you might be sensitive to. Um, I like a stool test that looks for the bacteria that's growing in the digestive tract as a basic inquiry. Uh, what good bacteria is growing, what bad bacteria is growing, and then look at the short chain fatty acid levels so that we can determine that's the food that feeds the good guys. So we can determine if you need to be supplemented with short chain fatty acid. Butyric acid is an example. Look at the bacteria, food allergy, look at the bacteria, and then organic acids to determine what level of inflammation is going on in the gut, and what your digestive and assimilation capabilities are with the food. So that would be the basic. Um, and do you think the Dutch test is useful given it's only tested during a few days of your cycle? I like the Dutch test. Um, the one I've used more is a female hormone panel. Depending on your age and depending on the symptoms, we can order a female hormone panel that tests for 30 days. So tests uh, uh, basically it's a kit that you have at home, and I think it's every 3 or 4th day, every third or fourth day, you take a saliva sample, and you put it in the refrigerator, and you continue to collect. I think 11 samples throughout a month, and we can really get an idea of what that cycle is throughout the month. So I do like the Dutch test, but there are some more extensive tests out there um, that last a little longer. So I think that's maybe, unless there's a quick one. Oh my gosh. Love that you guys asked so many questions. Real quickly, I'm going to have to go here. Can I take vitamin D and magnesium together? Yeah. Yes, you may. Okay. I'm going to have to wrap things up for this week. Thank you all for joining me again. Um, I'm happy to repeat uh, this conversation about functional medicine labs. But next week, same time, same place, we are going to be talking about supplements. That's what a lot of people want to know. What supplement should I take? What supplement should I take? And I'm not going to be able to give specific advice for you just because I don't know your case. But we will run through a variety of different supplements and what they might be useful for um, symptomatically. So I've enjoyed my time again. I thank you all very much, and we'll see you again next week. Take care.